Some of America's most vibrant cities have become virtual ghost towns in recent weeks. In an attempt to control COVID-19, strict social distancing measures have been implemented. The aim, to slow the rate of infection and stop the potential of scenes like this from Italy, of hospitals overrun.
We don't know when the surge is coming. We hope we don't peak. So the idea here with the social distancing is to flatten that curve out and not see a peak.
The US now has more cases of COVID-19 than anywhere else. But unlike Italy, where the mortality rate of confirmed cases is around 10%, the rate in the US at this stage is closer to 1.5%, according to the Johns Hopkins Coronavirus Resource Center.
What would push us there is if the number of very sick patients requiring ventilators continued to rise, and that would overburden our resources at the hospital level.
Hospitals across the US are preparing to deal with COVID-19. This is the main lobby for Rush University Medical Center in Chicago. But the area is being repurposed. So as the rest of the hospital fills up with COVID-19 patients, this space will be able to treat other patients arriving with other emergency issues not related to the virus. But even that expanded capacity could get overrun, which would then potentially expose a shortage of life-saving medical equipment.
The mortality rate would obviously go up if you're not able to provide, aggressive ICU level care for the people who need it. When you make a decision about putting a patient on a ventilator, it's a life-saving intervention, and if you're not able to provide it, it's going to lead to a poor outcome, obviously.
Another issue facing the US is a lack of personal protective equipment. Some hospitals are already reporting shortages.
We change masks at this institution. We go through about 10,000 a day. And so we need more personal protective equipment, because if you can keep the healthcare team healthy, we could keep treating the patients.
There are various factors that explain the different mortality rates around the world. An aging population, as is the case in Italy, is one. But so too widespread testing, which allows a country to concentrate its efforts in stressed regions.
Going forward, understanding the magnitude of the infection and where it is, and trying to focus our energies to where the hot spots, and trying to really limit the sort of transmission of that. I think we really need to do more testing to understand where to focus our resources.
The full impact of the COVID-19 pandemic in the US is likely still ahead. But the experiences of healthcare systems and workers from around the world bring a shared focus, united in the fight to stop the spread of this deadly virus. Dan Williams, CGTN, Chicago.